This evidence-based appraisal looks to answer the question of what is the current evidence for the use of silicone gel post-burns for increasing range of motion, decreasing pain associated with hypertrophic scarring, and enhancing the cosmetic appearance. The research article looks at the effects of conservative treatments on burn scars. This systematic review was conducted by Anthony Nissen et al. In 2016. The research aim was to summarize the available literature on the effects of conservative treatment of burn scars in adults to reach a consensus on best practice guidelines. The methods analyzed included silicone gel therapy, massage, pressure, a combination of pressure and silicone, hydration, and therapeutic ultrasound. The study design was a systematic review, looking at data from PubMed, Embase, and Web of Science. The search parameters used a large number of key terms using Boolean search methods. The inclusion criteria included 2 reviewers checking the titles of the studies found according to each search strategy described. Each relevant publication was categorized using a PICO model. Objective terms included range of motion and functional capacity. Subjective terms looked at redness, pigmentation, pliability, thickness, texture, pain, and pruritus. The exclusion criteria included children, patients with keloids, surgical intervention, healing with laser therapy treatments, and those concerning product safety. The data analysis used the Scottish Intercollegiate Guidelines Network scoring system, which was used to assess the quality of the selected studies. The methodology checklist for the randomized control trials was described by the sign, and each was completed. The internal validity of each article was scored on 10 questions ranging from randomization, concealment, blinding, groups similarity at baseline, amongst others. According to the sign criteria, 5 of the articles were judged to be at low risk of bias and thus were seen as high quality studies. 11 were acceptable, 6 were low quality. In 10 studies there was no dropout. The remaining 12 articles had a dropout ranging from 6.7 to 30.4%. Of note though, there was 18 randomized control trials, but 14 of those use a poor randomization method, which pertain to no computer-generated allocations. Subjective outcome measures included Vancouver Scar Scale, subjective skin status, pain was questioned using a VAS, and a patient and observer scar assessment scale. Objective measures included goniometer for joint range of motion, ultrasonography to measure scar thickness, tissue ultrasound palpation system, a derma spectrometer, among others. When looking at the results in silicone gel application, in almost all studies, elasticity was assessed and significant improvements were found in favor of silicone gel. In some cases, elasticity was measured objectively, whilst in other cases, a subjective scale was used. The treatment effect for one study plateaued after 2 months. However, the remainder of the groups found significant positive results for a mean measurement of 4 to 6 months when compared to control groups. Looking at the benefits of the treatment, there was improvements with redness and erythema after the silicone gel treatment. Patient-reported pruritus was improved on the treatment arm. Tissue pliability was significantly better when compared to the control group, and scar surface tissue improved when compared to the control group as well. Let's now perform a critical appraisal of this systematic review and see if we can answer the clinical question. The strengths of this article included a wide variety of search terms. The objectives were clearly stated. The study characteristics were clearly defined. A list of included and excluded studies was also provided. The limitations of the article included numerous subjective and objective measures. However, not enough data for meaningful representation of either of these measures were collected. There was a narrow inclusion and exclusion criteria, a limited use of databases, And the sign methodology used is Scottish specific and not quite the gold standard required for a systematic review. In terms of validity, the study can be replicated using the information provided. It remained relevant for the PICO intended to study. There was no overrepresentation of the data, and the study also highlighted the randomized control trial's shortcomings of not using computer-generated randomization. In terms of negatives, the systematic review did not highlight the specific patient population pertaining to demographics and extent of which therapy was used. The large amount of outcome measures used did not provide enough data to accurately draw conclusions on which therapy was best for each patient population. The study was reliable because of the study characteristics and stringent methodology. The PICO group relevance was maintained at all times. There was a confidence interval of 95%, with no reported conflicts of interest that could create bias. In terms of negative, there's a range of articles which dates from 1994, and therefore this information may be less reliable in present day. Some of the studies were not directly compared, and therefore the effectiveness of treatment could not be contrasted. Furthermore, some studies lacked a control group. When looking at the clinical significance, silicone gel showed significant improvement in skin elasticity in almost all studies, decreased redness and erythema, patient-reported pruritus improved, pliability was significantly better when compared with control groups, and scar surface appearance improved when compared to control. Let's now consider what clinical application this systematic review has on our patient interaction. Now, if you look at linking the case study and the intervention, the use of silicone gel therapy will address Ronesh's current problems, aiming to reduce redness and pruritus of the affected area. It will improve skin elasticity, which can improve joint range of motion. It can reduce pain experience from hypertrophic skin hardening. It can improve the cosmetic appearance of hypertrophic scar tissue, and it will also lock in moisture, which will help with hydration of the skin, allowing for increased pliability. Therefore, silicone gel is a non-surgical intervention which has many different benefits that are relevant to Ronesh. In this instance, this intervention is indicated for use.